A protection drape is a sterile barrier used in medical and surgical settings to maintain sterility and prevent infection. Its primary purposes are infection control, maintains a sterile area, acts as a barrier against microorganisms and fluids, and minimizes infection risk. Patient safety, reduces post-operative infections and controls bodily fluids. Operational efficiency, simplifies sterile field setup and organizes surgical instruments. Compliance, ensures adherence to healthcare standards. Protection drapes are used in various NHS settings, including operating theaters for all types of surgeries, emergency departments for trauma and emergency surgeries, outpatient clinics for minor procedures, maternity units for cesarean sections, ICUs for invasive procedures, interventional radiology, and dental surgeries. Their use enhances patient safety, supports efficient workflows, and ensures compliance with healthcare standards, leading to better patient outcomes.